Good morning, classmates, especially to our teacher, Ma'am May Bakason. We are from Las Piñas and Bacoor, TC. Our topic is all about CDC developmental milestones for an 18 months old, to be discussed by me and my co-presenters, Miss Mary Grace Ponce, Arlene Sararana, Christine Ann Masing, and Miss Maria Pereline Macaya. And now, to start with, let's be attentive to listen to Miss Mary Grace Ponce, our first presenter with the said topic.
Thank you, Miss Charito. Good morning, Mom May. Good morning, classmates. Important milestones by baby by 18 months old. How your child plays, learns, speaks, acts, and moves. Other important clues about your child's developmental milestones are things most children, 75% or more, can do by a certain age. What most babies do by this age? Moves away from you but looks to make sure you are close by, points to show you something interesting, put hands out for you to watch them, look at few pages in a book with you, helps you dress him by pushing arms through sleeves or lifting up foot. Language communications milestone. Tries to say 3 or more words besides mama and dada, follows one step direction without any gestures like giving you the toy when you say, "Give it to me." Cognitive milestones, learning, thinking, problem solving, copies or doing chores like sweeping with the broom, plays with toys in a simple ways like pushing a toy car. Movement, physical movement milestones, walk without holding to anyone or anything, scribbles, drink from a cup without a lid and may spill sometimes, feed himself with her fingers, tries to use a spoon, climbs on and off a couch or chair without help. For 18 months old, mastered skills most kids can do, says at least 15 words, runs and walks confidently, feeds self with a spoon. Emerging skills half of kids can do, brush teeth with some help, jumps around, knows how to take his/her clothes off. Advanced skills few kids can do, understands more complicated instructions, shows signs of potty training readiness, draws circle and not just scribble. And that's my part of my report, and next proceed to the next reporter, Miss Arlene Sararana.
Other important things to share with the doctor. What are the some things you and your child do together? What are the some things your child likes to do? Is there anything your child does or does not do that concerns you? Has your child lost any skills he or she has once had? Does your child have special health care needs PR? Was he or she born prematurely? Concerns about your child's development, act early. You know your child best. Don't wait. If your child is not meeting one or more milestones, has lost skills he or she once had, or you have other concerns, act early. Talk with your child's doctor. Share your concerns and ask about developmental screening. The American Academy of Pediatrics recommends that the children be screened for general development using standardized, validated tools at 9, 18, and 30 months, and for autism at 18 and 24 months, or whenever a parent or provider has a concern. The next topic will be discussed by Ms. Charito Yekek, Tips and Activity.
Thank you, Miss Arlene. And now, here are the tips and activities what can do for an 18-month-old. As your child's first teacher, you can help his or her learning and brain development. Try these simple tips and activities in a safe way. Talk with your child's doctor and teachers if you have questions or for more ideas on how to help your child's development. Use positive words and give more attention to behaviors you want to see. For example, look how nicely you put the toy away. Give less attention to those who you don't want to see. Encourage pretend play. Give your child spoon so she can pretend to feed her stuffed animal. Take turns pretending. Help your child learn about others' feelings and about positive ways to react. For example, when he sees a child who is sad, say, "He looks sad. Let's bring him a teddy." Ask simple questions to help your child think about what's around her. For example, ask her, "What is that?" Let your child use a cup without a lid for drinking and practice eating with a spoon. Learning to eat and drink is messy but fun. Give simple choices. Let your child choose between two things. For example, when dressing, ask him if he wants to wear the red or blue shirt. Have steady routines for sleeping and eating. For example, sit at the table with the child when she's eating meals and snacks. This helps set meal times routines for your family. Limit screen time, TV, tablets, phones, etc., to video calling with loved ones. Screen time is not recommended for children younger than 2 years of age. Children learn by talking, playing, and interacting with others. Limit your own screen time when you are with your child so you are able to respond to her words and actions. More tips and activities will be given to us by Miss Masing.
Thanks, Miss Yakit. Ask your child doctor and or teachers if your child is ready for toilet training. Most children are not successful at toilet training until 2 to 3 years old. If he is not ready, it can cause stress and setbacks, which can cause training to take longer. Expect tantrum, they are normal at this age and should become shorter and happen less as your child gets older. You can try distractions, but it's okay to ignore the tantrum. Give him some time to calm down and move on. Talk with your child by pacing her and getting down to her eyes level when possible. This helps your child see what you're saying to your eyes and face, not just your words. Start to teach your child the names for body parts by pointing them out and saying things like, "Here's your nose," "Here's my nose," while pointing to her nose and your own. Trying to respond to your child's behavior in a safe and loving way, stay consistent as much as possible. Teach your child more words by adding to the words she say. For example, if she say dog, say yes, that's a dog. Dog say whoop whoop. Read books and talk about the picture using simple words. Play with your child by rolling balls back and forth, pushing toy car, and putting blocks or other items in and out of container. Play simple games where both of you have a part to play, blow bubbles, and let your child pop them. Say things as he pop them, such as pop pop. Create a spot in your home for your child to go to when he is upset. Stay nearby as your child knows he is safe and can come to you for help, calming as needed. Give toys that your child can push or pull safely. Give toys and things to your child that encourage pretend plays such as a doll and a baby blanket. Thank you. Next presenter, Miss Makaya.
Thank you, Miss Christine. For the summary, your 8-month-old toddler is now walking and using basic words. At this age, children love to play and explore. They begin to show some independence and may play pretend and point at objects they want. They also begin to understand what things in the house are used for, such as cup or spoon. Your toddler may have temper tantrums around this age when she or he grows frustrated trying to communicate how she or he feels. And that's the end for our presentation. Thank you!